Hey everybody, Dr. Wes here with the Therapy Guys. Hope you're doing amazing. So we're going to be starting our dry needling series today. Hope you're excited for that. Today we're going to be doing the suboccipital muscles, which are amazing muscles to needle for people dealing with headaches, neck pain. So hope you enjoy the journey today. We're going to give you some different views. I'm going to be wearing a GoPro so you can see what I'm seeing. We'll explain, where we're at, the reason behind the dry needling. So I hope you enjoy the content. All right, so first muscle we're going to do in the suboccipitals is the superior obliques capitis. And this muscle is out laterally. It originates on the transverse process of C1, and then it comes up and attaches on the occipital bone between the superior and inferior nuchal lines. After we do that muscle, we'll slide over medially and do rectus capitis posterior major, which originates on the spinous process of C2 and comes up and attaches laterally on the occipital bone, once again around the inferior nuchal line. Now, both of these muscles we do help to extend our head or to look up, as well as do some side bending. So anyone dealing with pain, moving their neck up to the sides, dealing with headaches, this is a great muscle to do. So we clean off the skin with alcohol and we feel for our landmarks. We feel for areas of the muscle that feel sore or tight and achy. Trigger points are parts of muscle that are really inflamed, and so a lot of times as we're palpating, we'll feel those spots as we run our hands over those areas. It will feel different than other areas of the muscle that aren't having issues. So once we identify that, we do a quick firm tap of the needle, goes down in within a second or two to the area that we are looking for. We're always knowing where we're at by using landmarks with knowing anatomy. So we're always staying safe and minimizing risk of anything happening. A lot of great benefits of dry needling that we'll talk about here in a sec, but what we're going to do is hook up the electrical stimulation. And I love using electrical stimulation. It's kind of an adjunct to the needling itself, and it can really enhance the treatment, increasing blood flow, as well as that pain-relieving analgesic effect. So that's why we like to use that to help really maximize the dry needling instead of just doing the needling itself. The electrical stimulation is always to the patient's comfort, and we typically will try and go for about 5 to 10 minutes or longer sometimes if patients can tolerate that, and a lot of times they will ask to go longer because it does feel good and they see those good results. So once again, I love dry needling. It's a great technique, and it's really been shown to be powerful at decreasing muscle tension, decreasing tone, improving range of motion, decreasing pain. And so it's a huge part of what we do here in therapy in helping people, like I said earlier though, along with doing exercises and other manual techniques as well. So you can see we've got a nice twitch response going, so we're going to let her enjoy the E-stem and go from there. had our patient on here for about 5 to 10 minutes. As soon as it was done, what we would do is turn off the electrical stimulation, take the needles off, and set the patient up. At that point, a lot of times, one of the great things about dry needling is not only do we see long-term improvements and changes, but we will have immediate changes occur. So we would sit the patient up, oftentimes retest certain ranges of motion or strength depending on the muscle that we did, and we will see that immediate change. So physiologically, we've gotten rid of inflammation, we've increased circulation, and helped this patient get well on their way to feeling better. All right, everybody, I hope you enjoyed the video today, seeing the suboccipitals get needled. Once again, if you're dealing with headaches, neck pain, find a provider that can do some dry needling. I promise you this will definitely help if you're dealing with those things. Once again, like, subscribe, turn on those notifications so you can get more amazing content from us as we continue to show you dry needling, exercises, and other awesome tips for more health and wellness.